Today we are beginning our discussion of diseases and disorders of the integumentary system. We'll start off by talking about the different types of wounds. A laceration is a cut or tear of the skin, and this causes bleeding. Lacerations can be caused by a sharp object, such as if you were slicing up some fruit and you accidentally cut your finger with a knife. That could be an example of a laceration. The treatment for a laceration would be to stop the bleeding and then to also clean and dress the wound in order to avoid getting infection. The next type of wound we have is an abrasion. An abrasion is the scraping away of skin. So an example of an abrasion would be if you were riding your bicycle and you fell off and hit the pavement and scraped your elbow. This would be rubbing your skin against a rough surface. Now, an abrasion doesn't typically have as much bleeding. Treatments for an abrasion include to wash the area with soap and water, and you may cover if needed. And then we have a puncture. A puncture is a deep wound that's caused by a sharp-pointed object. Now, punctures may not bleed much, as the sharp object can kind of form a plug to where you're not bleeding as much that you can see. The treatment for a puncture is to wash the area and stop the bleeding. You don't want to remove the object from the wound. Rather, you want to seek medical attention instead. And then the last two types of wounds that we'll talk about are, one is an incision. An incision is the result of having surgery. It's a surgical cut. An example of an incision would be if you had your gallbladder removed, or if you had open heart surgery, you would have a surgical cut or incision in the center of your chest. Incisions can have things like stitches, staples, or glue to help bring that skin back together. And the treatment for an incision would be to follow the doctor's orders. So some doctors may want you to keep that incision area dry, while others say it's okay to get it wet and you can wash it. And then lastly, we have an avulsion. With an avulsion, all layers of the skin have been torn off. You can think of this as being a severe abrasion. With an avulsion, all or part of the skin is missing. And so the treatment options for something like this would be skin grafts or reconstructive surgery. We'll now look at the different stages of wound healing. The first stage is called hemostasis, and the term hemostasis simply means to stop bleeding. During this stage, the blood begins to clot, and this happens really quick and within seconds. But understand this is a good type of clot. So we can think of clots as being bad or harmful, and they are if they're located in your lungs or in your brain. But this kind of clot is the kind you want because it helps to stop that bleeding. The next stage is scabbing over, and this is continuing in with the clotting process. With this, the blood vessels are going to narrow around the wound, meaning less blood flow is going to be going to that area. And then platelets are going to make a plug or a platelet plug. Now, platelets are tiny blood cells that are made in bone marrow. Platelets are sticky and they clump together. And that's what forms that plug in the hole of a blood vessel. And then you have what's called fibrin, which is a blood glue. And this blood glue holds the plug in place. And this is what forms the scab. In stage 3, this is the rebuilding or the growth and proliferation phase. During stage 3, the body begins to repair that skin that has been damaged. And this is also where a scar could form. And then in stage 4, this is the maturation or the strengthening phase. During this stage, the body continues to repair and strengthen the area, and you may feel itching. So it's interesting to think about what causes itching during the healing process. And so to help address this, when the body is injured, histamine is released. So you may have heard of histamine, like antihistamines. But histamine is important because it helps to support cell regrowth. However, it does cause a reaction, and part of that reaction is that feeling of itching. And those are the stages of wound healing. Now we're going to move on to acne vulgaris. And when you see the term vulgaris, vulgaris simply means it's the most common form of a given disease. And acne is the most common skin disorder in the United States. Now you may have heard of like eating things like French fries or pizza or chocolate and dirty skin can cause acne. But those claims are largely false. Okay? Rather, acne vulgaris is caused by things like excessive oil production, clogged hair follicles, bacteria, and influx of hormones. Those can all contribute to acne vulgaris. So what are the symptoms of acne vulgaris? Symptoms include the presence of pimples. And there are different types of pimples. The ones that we're going to look at today is starting with whiteheads. So whiteheads, and then just below that you see blackheads, but whiteheads and blackheads form because of clogged pores. And these pores are clogged with oil or sebum and dead skin cells. And that's what causes that clog to happen. Now the difference between whiteheads and blackheads is just simply that the whiteheads are going to be a closed pore, whereas the blackheads are going to be an open pore, so they're exposed to air. And so when that trapped oil and trapped skin cells become exposed to air, that causes them to turn black, and that's how you get blackheads. Other types of pimples include things like small raised red bumps, and then also underneath the skin you may have this pus that can be quite painful, but that's another type of pimple. The treatment for acne vulgaris can vary based on the severity. For more mild acne, it can be treated with over-the-counter products such as things that contain the substance benzoyl peroxide. Benzoyl peroxide is an antibacterial agent, so that can be used to treat acne that's caused by bacteria. You can also get prescription oral antibiotics that would need, of course, to be prescribed by a doctor. And then there's even laser therapy, which is being used. Laser therapy targets bacteria, oil gland activity, and also helps to reduce inflammation. We're now going to look at albinism. So albinism simply means a deficiency in pigment. And when we talk about pigment, it's a deficiency in the pigment melanin. Albinism is a genetic disorder, and it causes the skin, hair, or eyes to have little or no color. Now, the symptoms of albinism, and the most prominent that the common form of albinism is characterized by, is having that pale or almost white-looking skin. The eyes can also be very light in color. And due to the paleness of the skin, it can cause sensitivity to the sun. With albinism, there is no cure. However, there are treatments to help to protect the skin, so individuals with albinism need to be careful with their exposure to the sun. And due to the eye conditions that can result from albinism, such as having impaired sharpness of vision and having problems with depth perception, these eye conditions can be treated with things like prescription corrective lenses. Next, we're going to look at a fungal infection, which is called athlete's foot. It's a fungal infection of the foot. and it is highly contagious, meaning it's easily spread from one person to another. Athlete's foot can be common in spreading places like particularly locker rooms, where you have people who could be walking around barefoot and just having themselves exposed. The symptoms of athlete's foot include a scaly rash that causes itching, stinging, and burning. And with it being a fungal infection, the treatment would be antifungal creams. It's also recommended to keep feet clean and dry, not sharing towels, and wearing shower shoes so that your feet aren't going to be exposed to an unclean surface. Another type of fungal infection is called ringworm. But interestingly, it's not actually a worm. But rather it kind of looks like a worm in appearance. It's a red scaly ring shaped patch on the skin. And the treatment for ringworm is antifungal creams. And the last disorder that we are going to look at is called eczema. And eczema is also called atopic dermatitis. It's a chronic, meaning it's a long-lasting disorder, and it tends to flare up periodically. So people can have times where their eczema can be very present and times when it seems to be in remission. Eczema is related to a gene variation, and risk factors for eczema can primarily include having a personal or family history of eczema. Also, having trouble with allergies, hay fever, or asthma can contribute as well. Now, the symptoms of eczema can vary person to person. It can include things like dry skin, itching, having red patches, and the presence of small red bumps. And so you can see in this picture the small red bumps on this individual's forearm. Now, in treating eczema, it can be best to try to avoid things that can trigger eczema. Common types of triggers for eczema include things like sweat, stress, obesity, detergents, dust, and pollen. The treatment for eczema would be to, again, try to avoid those triggers, also avoiding things like harsh soaps, moisturizing your skin regularly. You may be prescribed medicated creams or ointments, and then also to limit the time that you spend in showers or baths. It's recommended to limit that to 10 to 15 minutes. And that does conclude the first part on our discussion of diseases and disorders of the integumentary system.